Good evening. I'm Bonnie Monroe, your host for this evening, and this town hall is brought to you by Mia Mason for Congress. I'd like to welcome our special guest tonight, Dr. Renee Walton. Before we get started, I want to remind everyone that if you have questions, please feel free to post them in the chat. Before we introduce our wonderful hosts, I'd like to start the town hall with a focusing activity to get everyone's mind into the right place for tonight's discussion. So please post your answers to the following question in the chat box. What is a disability? While those answers are coming in, I'd like to introduce our guest. Dr. Donna Renee Walton, EDHD, CCBT, is an author, speaker, and disability advocate. After a dangerous form of bone cancer threatened her life and forced the amputation of her left leg in 1976, Walton spent decades working to rebuild her world through setbacks, trials, and tribulations. Dr. Walton has spent over 20 years in diversity and disability employment services, where she distinguished herself as a leader, advocate, and proponent of equal rights for persons with disabilities in both public and private sectors, including the Equal Employment Opportunity Commission, the United States Department of Labor Office of Assistant Secretary for Administration and Management, the Centers for Disease Control and Prevention, and the George Washington University Center for Rehabilitation Counseling, Research, and Education. During the Obama administration, White House Disability Liaison's Disability African American Kitchen Cabinet, and selected to serve as moderator for panel discussion on exploring the intersectionality of identity in the quest for social, cultural, and economic justice during National African American History Month. Dr. Walton was later invited back to the White House to serve as a subject matter expert for Work Group on Accessibility and Inclusion. By using the organization she founded, the Divas with Disabilities Project, as her platform, Donna has made an unprecedented impact in the disability and women of color communities as a hub for thoughtful discussion on issues, self-love, and empowerment, and reshaping the perception of what disability looks like by promoting Black and brown women with physical disabilities through various media platforms. We are also joined by Mia Mason, running as the Congressional Democratic nominee for District 1. She is a 20-year veteran who served in the Army, Navy, and DC National Guard. Mia retired in 2018 and shifted her focus to advocacy and fighting to restore equity and equality back into our communities. While answers are coming in, I'd like to ask our hosts, our guests, I should say, their response to the question, what is a disability? Donna?
Well, you can look at the formal, excuse me. First of all, thank you very much for having me on this platform. I'm very excited to be here. If we look at the actual definition of disability, we will find that it means that it's a physical or mental condition that limits a person's movement, senses, or activities. We'll look further into the dictionary and we'll see all of the similar words: disorder, condition, dysfunction, affliction, ailment. All the words that describe or give meaning to what a disability looks like, or give meaning to what disability is, but actually really doesn't define disability, in my opinion, for a person.
And Mia, would you like to add to that?
I think she hit the definition right on the head, but me, with what I've gone through, it's more of an impairment. It is something that I'm not used to. It is something that I feel that is lost. I feel that it's a degradation of the mind and body because we're coping with what our disabilities are, and we're struggling to, make do with what we have left. So that is my words for what a definition of a disability is. And we're here tonight to see how your project works and how it can help others so that we can overcome those struggles, impairments, and other disabilities we may have. So let's get right into it.
Well,
Glad to have you
would you
here.
like, okay, I'm sorry. Go ahead, Mia. I apologize. Go ahead.
Oh, I said it's glad to have you here.
Thank you. Thank you very much. If we want to start with the term disability, that's a good platform, a good jump off point to talk about the Divas with Disabilities Project. It was created, the Divas with Disabilities Project was created to sort of transform or to reshape the meaning of what disability looks like. And that's because of the stigma and perceptions that when you talk about affliction and when you talk about the sort of negative stereotypes that are imposed upon individuals with disabilities, if you will, we wanted to reshape that. So we wanted to show society what disability looks like. And we created DIVA, or used the word diva, to show that diva and disability can coexist in a single person. So we wanted to show that though you might be defined as named or described as a person with a disability, your disability transcends, the impairment, that you're more than the sum of your disability. And so the Divas with Disability Project advocates with other organizations to work to sort of change the perception, to look at individuals in employment, to show the ability or focus on the ability versus the disability, if you will. It works with making sure that we can advocate and be empowered so that we can actually change when you see a person with a disability who may use a wheelchair, who may be blind, who is deaf, that you will not necessarily discount them, that you will see that they are empowered and they are able and capable of being, a part of society and a part of employment.
Yeah, I completely agree with you because a lot of our friends, they may have like MS, lupus, being an amputee, or many of our veterans face loss of their vision, their hearing, their sense of touch. And these are some of the things that a lot of us face on a daily basis. And I hope tonight we can answer a lot of the questions that our host is going to provide us, because we want to be able to not only work on the county level, but the state and the federal level to make sure that everybody is taken care of, regardless of their ADA needs, so that it is broad and encompassing all.
Wonderful. That's good. Go
ahead.
No, I was just going to add to that and how we facilitate that on the federal level. There are many ways by which persons with disabilities can be facilitated and being a part of the whole employment and the workforce. So I think this is a great topic so that we can really talk about disability, because sometimes it's not talked about. It's in the way, in the context that it needs to be, having a conversation about it. We want to remove the stigma away from disability so that we can welcome the conversations around it. Just so that people can self-disclose that they have a disability, because some disabilities, as you know, are not visible. And so a lot of, preconceptions and notions are made there as well.
I think that one of the hardest things to do for anybody who has a disability is come out to their employer once they're hired, or disclose that in the hiring process, because it puts them in a disadvantage. Even after starting work and you're trying to make do as a normal person, some of the hardest things to say is stairs or elevators or waiting for other things to come through, because many places aren't ADA accessible. And then, of course, whenever you're tired or you need breaks, this really affects somebody who has a disability and allows a lot of discrimination to happen. And let's try to talk about how to fix this. What can we do together to, try to end this discrimination that we face?
That's a good question, Mia, because one of the things we cannot legislate attitudes. And attitudes is the major, number one, barrier towards accepting and facilitating, employment with persons with disabilities. But one of the things we can certainly do, the federal agencies can do, is you can remove those barriers. You can certainly make your workplaces accessible. There are most accommodations cost less than $500. To sometimes just make, having someone sit at their desk and just have it being ergonomically, sufficient. Telework, as we know, and we've seen through COVID, that telework now is standardized, that it doesn't really require much to allow a person to work from home, and it actually does facilitate the person to be much more sufficient and be able to contribute to the workforce. Having policies in place, like say for example, the Schedule A hiring authority. That's an authority that allows individuals with disabilities to be employed based on their disability because they have a disability. It's not, I wouldn't say it's quotas, but it's saying that we know that individuals with disabilities have not had the fair advantages of being in the workforce. So with Schedule A hiring authority, it allows that to facilitate individuals with disabilities to sort of take priority, if you will, over certain positions. And hopefully they'll get in positions that are more leadership oriented, that they won't be just, sort of relegated to positions that are low wage, that we want to, elevate, the position of persons with disabilities. Again, we want to change the perception, right? We really want to elevate and give the notion that people with disabilities is a detail. Is not the whole person.
Yeah, I have to completely agree. And we got to hear a lot of your personal stories. So allow me just to take a moment to share mine. I worked with an employer for nearly 3 years, and near the end of that cycle, I switched positions, got what I needed to help, make sure that I could maintain my job, do excellent in what I was doing. Corporations were very excited about, bringing me up into a leadership position. So before anything else happened, I wanted to disclose disabilities because I'm a veteran. I've gone through a lot. I understand a lot of people go through things. And immediately I was discriminated upon, given an immediate needs to improve, and asked to be a maid and manage my time more wisely. Needless to say, this happened right after Mother's Day, and I decided to just put in the 2 weeks notice and continue my advocacy because I couldn't allow this to happen any further because I wanted to excel and not be regimented to, further discrimination and go down the same rabbit hole I've done with a previous employer and, go through the legal nightmare that we have to describe what a hostile work environment is, describe what discrimination is. That also increases a lot of mental disparity to those who have a disability because then they're fighting for equality or they're fighting for that equity. And I decided to bring this to a higher level, and I'm glad to be able to talk to you about this tonight.
Wonderful, wonderful. Well, it's a great topic, and as I said, the more we put this out in the open and have open discussions about disability, we can remove the stigma. I mean, self-disclosure is very difficult, and I certainly understand, the hesitation when individuals are interviewed. They don't want to disclose their disabilities, and actually, they should not have to disclose their disabilities. However, you do want to be accommodated. I have a short story. When I first, my amputation was in 1976, and so it was a traumatic experience, to say the least. But I did not want to identify with terms such as disabled, crippled, all the negative terms. I did not, and I did not want to. I did not want to disclose it. So I would sort of try to act on this sort of duality of life. I would have walk with my prosthesis and would not bring it up if someone didn't bring it up, or why are you walking like that, which is always common. Why you walk like that? What's wrong with you? But when it comes to employment, it is necessary to self-disclose. Because you want to be accommodated and you have the right to be accommodated in the workforce. So I know it is, you don't have to accommodate when when you're employed. You should not even be asked interview, I should say. You should not have to ask, the employer should not ask if you have a disability, but they certainly can say, is there any accommodation that can be provided that will help you, do your job more efficiently? That's an appropriate question. And I think at that time, that could give the person with a disability an opportunity to either make the decision to disclose or not disclose.
One of our viewers has asked the question, can you talk a little bit more about how accommodation is critical to success in the workplace?
Absolutely. So, you know, first of all, each person with a disability is not monolithic. So they all sort of, their lived experience and the way they navigate life is different. So accommodations sort of, they help you to be successful. So just something as small as having a sit-stand desk, for example, can make all the difference if you have, lumbar issues, if you have, issues which you have to stand, give yourself a break. And actually, as an ergonomic sort of, plus right now, everybody can sort of benefit from that. Or like different mice that you can use so that you can avoid carpal tunnel. When we talk about the exactly, there are all kinds of accommodations that don't cost a lot. One that I see common is an anti-glare screen. That helps to reduce the strain on your eyes. Individuals with visual impairments, I should say, and there is a difference. Someone who is visually impaired, who's blind. I mean, those terms are used interchangeably, but there is a difference. So a person who's visually impaired, who might be legally blind, if you will, needs a screen enlarger, needs JAWS. I mean, which is a screen reader. So there are just all kinds of accommodations, but they're very, very specific. No one accommodation fits all. But some persons with disabilities might, use the same types of accommodations. But I think that every accommodation is requested on a case-by-case basis, and it should be implemented individually.
I completely agree. So let's continue moving into these questions. I know we kind of jumped away from it and went into our stories.
Those are all very important as well, and great learning for everybody experiences. Question for you, Donna, and then you can follow up, Mia.
Okay.
What can Mia do on a federal level as a congressional member to support organizations like Divas with Disabilities?
That's great. And I think I sort of alluded to it earlier, but you can work to ensure that there's a standardized utilization and oversight for implementing Schedule A, which is the hiring authority across the federal government. There lacks consistency for hiring qualified people with disabilities, and in particular, there seems to be inequities on those who are hired. So Schedule A really does help to facilitate or even the playing field, if you will. Stronger penalties need to be reinforced for Section 501. So that when persons don't accommodate, then there's some type of, penalty towards that. Again, you can't legislate attitudes, but you certainly have policies and laws in place that can certainly be worked with. It shouldn't be easy to discriminate against someone. And Section 501 is put in place so that you do not. So I think a lot of oversight and working with that particular part of legislation is really, really important. And the last is Section 508, which is access technology. Ensuring that everyone has a working plan for Section 508 to ensure that access technology is in the workforce. I mean, I think COVID has exposed a lot in terms of technology. Individuals working from home now, some of our systems in the federal government are not set up for Zoom. They use different platforms, and people, just can't access them. People with disabilities can't access them. So I think that's another area that just needs, just consistent technology across the federal government.
Well, I can definitely work with you on the Schedule A, and I can definitely work with you on, I completely understand your perspective on attitudes. We can't fix that. But, we can definitely make sure that there's more diversity training and ADA training to make sure that it starts at the federal level, because our private employers often have to pay for training like this, and the federal government is kind of mandated to make sure that we do this. And of course, use the EEOC,
DLC.
Military, I see you had a lot of acronyms in your bio once I read it. And I was like, yeah, probably from the military as well. But, normally from the Equal Employment Opportunity Commission, we can definitely work with them to make sure that these are enforced. Because, like for me, I knew that later on that I would have to go through a legal nightmare in order to try to prove and try to do everything else. And it just became harder. And and then they just multitasked me and then didn't even allow me to delegate. And I have to say, sometimes when things go out of commission, like an elevator, it seems to be always on your worst day. And for me and my feet, it's kind of a bad thing to happen. And I'm overdue for my left foot, but I got my right foot done before I started this campaign. And, it's just one of those things that we have to suffer and strive through in order to make successful. I think that, supporting organizations and telling them and asking them what can we do is very important. So thank you for sharing that answer with me. And we look forward to working with you in the future after the election.
Thank you.
Next question coming in is relating back to your comment on the legislation of attitude. Can you also talk about how lack of media representation affects attitudes? And what do you suggest to fix the lack of media representation for individuals with disabilities?
That's a really good question. That's a really good question. And that allows me to really talk more about the organization, the Divas with Disabilities Project. It's a nonprofit organization, and it was created to amplify the images of Black and brown women with physical disabilities so that they can be seen, so that they won't be erased. And so one of the most potent ways to do that is through media representation. Hollywood right now has less than 2% of actors with disabilities. And even when they do go out to get actors, they don't choose someone with a disability. Changing the story, having people tell their stories with disabilities so that they can be on screen, so they can be in print media, so it can be in advertising. I mean, just think about it. If you think about what mass media looks like, how many ads, if you will, do you see representing yourself, right? I'm an amputee. I see very little, ads that I can be. I say, oh, well, I look like that. I can do that. The more you have positive representation of persons with disabilities can see themselves on, in society at large, and particularly through media, on television and film, then it gives them a sense of efficacy. It's self-efficacy. It shows that, first of all, that you're included, that you are a part of the American society. That it's just not all these one-sided images of not seeing yourself. And it helps us to be restored and empowered. And it helps us to replicate and help others, to give them more strength to move on.
I think you're absolutely correct, which means that we have to be able to change the mindset of those corporations, those drug companies. So we'd have to work with the FCC, the FTC, the SEC, and say that, look, we're not going to push your drugs anymore on TV. You need to be able to show what you can do for our communities. And if you need to say that this is part of a drug program, it needs to be able to show why it is, what it's for, and then a recovery. I just don't need to see grandma, grandpa, some kid, or anybody from our community, having a symptom and then contact your doctor for more if you're suffering, blah, 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 and 30 seconds of legal terms and actions for whatever side effect this medication is going to have. It should be representative of everyone, and that's something that we can definitely work forward to, because just like any type of when tobacco used to be on TV, we used to cut that out, and we got rid of all their billboards and everything else, and if put warning labels on everything else. This is the type of legislation that we should be able to do to make sure that if a drug company wants to advertise, this is the way that they have to be able to do this. By including us, because this is who it affects.
That's wonderful. And Mia, I don't know how we can impact this, but another area too is, you're right, and that's a great idea. I didn't even think of that, is terms of working with the pharmaceutical and the FDA. I mean, absolutely. Yeah. They can have a lot of impact on changing, what the advertising looks like in corporations, the corporate media. And so we need to shift this, and like the corporate, we need to shift in corporate media policy to be more inclusive of all types of women. When we think about the standards of beauty, and from the standards of beauty, how they're reinforced by the multi-billion-dollar beauty industry. And so, there is an urgency for broadcast media and corporations to cease playing on women's insecurities in their bodies. And that really falls right in line with women with disabilities. We need to amp up those images of beauty and how it looks with women with disabilities.
Yeah.
And men. It doesn't matter just what the standard of, I don't want to use the word normal, and I hate that word, authentication, right? Authenticity. A person's daily lives with a disability are beautiful. They are beautiful.
I agree.
And they should be viewed, at their bodies are perfect bodies. Because, perfect is relative. I think I have a perfect body. I love the symmetry of my one leg. I like that. I know that sounds really weird, but I do. I think it's very beautiful. I love looking at the fact that, wow, that's kind of interesting. I like my symmetry. And so media can have a really major impact on that and changing the perceptions.
I completely agree. Go for the next question. Yeah.
Next question. What else needs to be done on a legal level to provide equal access to opportunities for people with disabilities?
I think that to answer this one is more about, the legislation that we bring forward is, what type of legal needs do we need to protect our communities with people with disabilities? I think that is kind of the correct question because, normally whenever we bring the healthcare project or anything else to court, we know that we're going to have to work bipartisanship. And normally they're going to throw something sneaky in there so that they can take us to court. So in a legal sense, what can we make sure that isn't going to end us in court and remove any type of legislation in our future? I think that's probably gives us a lot more depth and focus into what we're trying to do. So what are your thoughts?
I just think that if the legislation has more teeth, I really hate to go back to the penalty again, but I think that's where the change really comes. When people see that there's a penalty towards discrimination, when they see that there's a penalty towards denying access, when they're seeing that if there's something attached to that, I think that's changing behavior. Unfortunately, that's just my perception about how behavior is changed. It's almost as if there has to be a penalty behind it because attitudes are just difficult.
Yeah,
and more oversight, Mia. A lot of oversight and evaluation. We need to really attach metrics to some of these things, and so that funding is attached to the outcomes. And that too can help sort of shift the way people are treated and the way systems are developed and everything like that.
Okay, so more like a feedback 360 evaluation for oversight, and then of course what you're also talking about is using our USC code and making sure that we've scripted what actually will be a penalty and actually put a penalty in there of 2 to 5 years or a fine so that we can actually have classifications and violations for that. The question will then be is what title do we put it under and should we duplicate it in multiple titles? So let's work together offline and see what we can do in the future. I'd love to work with you on that. And I think
Thank you. That's a great idea. And another area too, in terms of I don't want to say penalty, but in terms of getting people to change of behavior and to facilitate more positive outcomes for persons with disabilities is in HR. In HR, for example, or not just HR, I guess any department, any division, managers, when they had their performance evaluations, and they are asked how, or if they have to hire someone, if they can choose from a Schedule A, hiring cert, if you will, certification, and they don't choose from that cert, I think the question should be asked in their evaluation, performance evaluation, is why.
Yeah.
It's like holding people accountable for what they don't do. And then maybe we can get to the understanding, because sometimes you kind of wonder, why didn't you choose that person who was just as qualified as a non-disabled person?
Yeah.
And then holding them accountable to say, well, if you don't have a rationale, then the person should be hired, and then that's somewhat evaluating their performance evaluation. That's something that I've been thinking about. And I don't know if you can help facilitate that. That would be wonderful.
I agree, and this is another wonderful reason why we need to make sure that the ERA is brought forward, which is Equal Rights Amendment. It takes our Civil Rights Act and gives them some more teeth to dig into it, because we don't want to see more legislation bills like bathroom bills and stuff come in, because then we'll see like employers take away sex or take away color or take away something else from their EOCC clause, because you know what? They don't feel like they should do it any further, or EEOC. I think that is actually, why we need the ERA, to make sure that it also includes us. Because I remember Don't Ask, Don't Tell. It came forward, but it didn't include me. Not until 5-6 years later. And it has to be the same way when we pass the ERA. What is not included into it? What else do we need to add into it? Because we're going to have to vote on it again and make sure that it gets passed. So this is our opportunity in the next 2 years to make sure that gets passed immediately and add more teeth to it. I think that'd be beneficial for us all to make it part of our Constitution versus a code or just an act. But definitely want to be able to get it into the USC.
Wonderful.
Okay, we have another question comes in that is going back to what Donna was talking about, actors, etc., who have disabilities not being hired for those roles. The question is, how do we create a more inclusive media? Will that require policy changes?
Oh, absolutely. It will require those policy changes. And, we may it's going to have to go through a petition. And then, cast as a bill and then brought forward. I think this is the best way that we can do it, and maybe Divas with, disabilities can actually start a change.org petition, get the required signatures, bring it to congressmen and women, and let's move forward on this. We have plenty of time after the election, and we'll get it done.
That's fantastic. That's fantastic, because there are a lot of programs in the federal government that use media. I mean, that use filming. They use cinema. They creating their training programs.
Yep.
All of that is really important. I mean, you think about the last time you sort of watched a training program that wasn't about a person with a disability, that had a person with a disability included.
Yep. And of course, this will definitely provide a lot more small businesses owners, the minority and those with disabilities, to be able to start a business, to train not only our federal government, but to certify companies in these new policies. So that is a revenue stream that will help our communities who are currently out of work to lead forward, to help every organization out there be better suited to help those with disabilities, mainly to make sure that they're hired. Because I guarantee you, maybe 1 out of 30 resumes will actually get picked up with somebody who has a disability, because it puts them even at a further distance than color, sex, or Asian Pacific. It just makes us, that stigma sticks with us. So we need to be able to change that.
Very true.
Okay, very on point for where we are right now in this country. How has COVID-19 impacted opportunities for people with disabilities?
That's a good question. I can start with the organization. The women in my organization have been affected in 3 ways. isolation for one. So we just received a grant, in fact, to ensure or help those individuals who are affected by COVID, and that's all of them, but some at various degrees. So isolation, not being able to integrate, have your caregivers, your family, you further compounds the isolation that you've already somewhat had in the first place when you're not able to interact. Another area is being able to go to the grocery store, the transportation. That has been a real major sort of issue with some of the women in the organization, in that they now have to, the grocery cost is very expensive. Those delivery service, those delivery fees, is very, very expensive. So that puts them at risk. And a lot of individuals might live in food deserts where there's not great food anyway. And so transportation becomes another barrier, again, on top of not being able to get into the stores because of the whole, the pandemic, not being able to touch, not being, just being isolated. And the third is, of course, is employment. We have seen that a lot of individuals have not been able to keep their jobs, or are now underemployed because their jobs were not telework eligible, for example. And so that really, has placed them at risk of losing their jobs. So we've been able to use LinkedIn services, LinkedIn, I should say, social media to help, galvanize individuals to know that these issues exist, and to have people, announce jobs, because that's really important. Jobs that can be that are telework eligible.
Yeah, I completely
That can
agree
keep them
with you.
safe.
Yeah, telework is very important because, a lot of people who have disabilities lost their jobs, not only just because of COVID, but because that public transportation just wasn't running anymore. And it put a lot of people at disadvantages. And then to try to buy a vehicle that was disability accessible, you had a lead time. And then you had to fill out all the paperwork, pick the model, pick this, pick that. And then you would just end up in debt without a job. And there wasn't any assistance to be able to provide any catch up for this. This will, also allow us to touch base with, those who were in programs so that they could have vocational rehabilitation. This would also allow them to, instead of having a job, maybe actually go back to school and, succeed there. But then again, we were stuck with this COVID situation where you then had to do everything online. So were we paying for the internet? Were we paying for the rent? Was the person with disabilities being taken care of, or were they out on the streets now, the homeless person? And it's hard to see, but it's there. They're out there. They're hiding. When it comes time for it to rain, they'll go inside of a store and hang out for a couple hours, hoping that the storm will pass or the store won't close on them. And this also has to, basically, because of COVID and people losing their jobs, it's really affected their healthcare. It's pushed off a lot of things, especially if somebody had a disability with a surgery. This was, pushed off until they thought it was safe, or if it was an emergency, then you had to get tested, wait for your test to come back, stay isolated. That's why I couldn't do my left foot. It got very aggravated during COVID because I wasn't using my foot that much. And then they told me I would have to be isolated for nearly 14 days before surgery. I'm like, no. I have an election to win. Let's fix the policies. Let's get everybody their proper health care. Let's go for Medicare for all. And regardless of their disability, make sure they're covered and it's affordable for them. I think that is the best thing that we can do to provide more opportunities with disabilities so that they can succeed regardless of what COVID does to us.
But a very interesting point, though. We've talked about telework several times here, and that, of course, usually requires good and equitable internet access. So I know that's something you're advocating for, Mia. Would you like to speak about that?
Yeah, because it looks like I'm the only one with a stable connection right now. But But it's what you pay for, and that's what makes it hard for others to be able to afford. And that equitable part, especially in rural areas, may even leave you with DSL or satellite, which is very, very 20, 30 years ago, but it still costs a lot today. So we need to be able to make sure that we bring federal programs forward by making sure the state can install their fiber optic programs that should have been done years ago. Here in 2021, they have 650 miles of fiber optic cable and to provide internet to everyone, especially here in our district and on the Eastern Shore and in like areas in northern Baltimore that don't even have internet. The companies won't even come out to them. So these are the things that we can work with the governor, state legislators with once we're in Congress to make sure this actually gets done for our communities versus saying no to them.
Mm-hmm.
Another question has come in addressing to Donna. Can you touch on Global Diva Ambassador Program?
Sure, I can. So the Global Diva Ambassador Program is an outreach program created to reach divas worldwide through events, programs, and initiatives. The Divas with Disabilities Project's mission, as I talked about, is to reshape the perception of what disability looks like by promoting women of color through various media platforms. And so we interpret the meaning of look not only as the outer beauty, but also as the achievements and accomplishments of Black and brown women and girls with physical disabilities. Our Global Diva Ambassadors are volunteers who carry out the mission of DWD through events and initiatives. And they do this through advocacy and through meeting with organizations and meeting with other young women and girls in their respective countries. We have 5 countries right now that are involved, have Global Diva Ambassadors. So we're really happy about that. I think India just joined. But we have 5 countries, and we're just really excited about that. And they really go out and just really do a lot of education and awareness around disability. We call it Disability 101.
Good. So now that we're kind of at our conclusion, everybody can find me easily by calling 41094-MASON or going to miadmason.us or following us at Mia4MD. But how can us in our communities reach Diva for Disabilities, even if they're overseas?
Oh, absolutely. We have a robust website, divaswithdisabilities.org.
Okay.
And so go to divaswithdisabilities.org, and the platform is set up, it's accessible, and you can reach us that way.
Okay, awesome. Now, is there any type of specific program that you can talk about that will help them?
I'm sorry. Yeah.
What type of programs do you offer or services?
So the services that we offer right now is the Diva. We have 2 initiatives, I guess. The Diva Ambassador Program is one. And then we also just received a grant to support divas in the area of, like I said, food delivery services, a LinkedIn service, and Zoom to help them do their advocacy and activism.
Great. Well, that sounds like we got a lot more work to do to help you out.
Yeah, and I really should, I left off the social media handles. I should say that you could go to the website, but you could also find us on Facebook, Instagram, and Twitter.
Good. That's awesome. So make sure that everybody can take a look at Divas for Disabilities. Hopefully you've learned a lot about both of us tonight and why disabilities is so important to us and why we must protect our communities. So any closing thoughts?
I think that I just want to leave everyone with is that, disability is an experience. It is a lived experience. But it is not the whole person. It is a part of the person. It's a detail, I should say. But we can't segment ourselves. If you have a disability, you are a person with a disability. You are a person, and you're a person who happens, I should say, to have a disability. And you are whole. And I think that that's the one thing I just want to leave the audience with, that, that you are whole. And that doesn't have to define your entire life experience. The society may try to define that, but there are ways about which you can be, that you can show up unapologetically, as we say, to sort of just debunk and demystify what disability is.
Thank you for sharing that. It means a lot to me to hear that, especially to hear that whole part. It just, makes you feel like an actual person again versus, whatever term that somebody gives you a stigma on. It really changes our perspective to hear that. Thank you very much for having
You're welcome. You're very welcome.
in here tonight.
Thank you. Thank you.
Any other questions we might have, Monroe? I'll let you close it out.
No, that was the last of the questions that have come in. Well, thank you very much, everybody. It's been a wonderful evening with Donna and Mia, and I hope we were very informative as well. And we look forward to the next event.
Thank you.
Thank
All
you.
right. Have a good evening.
You too.
Awesome.
Good night, everybody.
Good night.
Be sure to watch us again as we're joining our debate here in a couple hours. So please, we'll be fact-checking everyone and making sure that we have a good time. So order some dinner and let's get going. Have a good night, everybody.
All right. Take care. Good night.
Bye.
Bye-bye.